I got it. There, it should be recording. So just disclosure to everybody. Oh, I see there are things in the chat box too. Sorry, I was so busy chatting that missed it. But okay, well, welcome everyone on behalf of the Mission Outreach Service team. I am glad to see so many people joining us for our January session on connecting with our mission partners. And today is extra special to me because it is about the Iowa City Free Medical and Dental Clinic, which I have been a part of for 15 years. Very excited and passionate about this project. So I'm going to open in prayer first, and then I will turn it over to Barbara Vinograde, the Executive Director. Heavenly Creator, thank you for the many blessings that you have given us. We praise you for your greatness. We praise you for your gifts, especially that of your Son, who came down and showed us how to heal the sick and help the blind see, comfort the forsaken, and give good news to the poor. So please, Lord, be with us. Open our ears, open our hearts, and open our minds, so that we can find ways to continue to bring your kingdom in heaven here on earth, in the name of your Son, Jesus Christ. So Barbara Vinograde has been with the Free Medical Clinic for the last 28 years. And that is both a testament to her wonderful personality and willingness to serve, as well as to the enduring presence of the clinic here in our community. And I am just so honored to have her with us today. She's not just my boss, she's a good friend. And I really admire all the work that she does to keep the clinic going, especially in these very challenging COVID times. So Barbara, I'll turn it over to you.
Thank you, Cecilia. Thank you for your very kind words, and good morning, everyone. I'm so glad to be here with all of you this morning. The first thing I'd like to say is how truly grateful I am for the support we have received from all of you and all of St. Andrew Presbyterian Church over the years. Your support has really made a difference in the lives of hundreds of uninsured people in our community. And I am so very grateful for that. What I'd like to do this morning is share with you just some nuts and bolts about the clinic and a little bit about how the pandemic has impacted us. And then I will turn the floor over to the Zoom floor over to Cecilia, who I will always admire. She has been one of the foundations of keeping us going throughout the years. Our clinic was established in 1971, and that means that this year we are celebrating 50 years of service. We are one of the longest running free clinics in the United States. As I'm sure you can imagine, we've been through a lot of changes in those 50 years, but our mission has remained the same, and that is to provide quality, comprehensive healthcare services for the uninsured and underinsured in Johnson County and surrounding areas. The free clinic was established on the basic principle that access to healthcare is a basic human right and a basic human necessity. Access to healthcare impacts every area of our lives, our ability to work, to raise a family, and to lead meaningful and fulfilling lives. At the clinic, we serve a low-income and diverse population. Although our population is diverse, all of our patients share the same challenge of not being able to afford needed health care. Most of our patients are employed and most have families. Many times our patients tell us that if the free clinic was not here, they would go without needed care or delay needed care as long as possible. Despite many changes in service delivery due to the pandemic, last year we served 1,589 patients during 6,307 clinic visits. The clinic's longevity is due to many community partnerships, both financial partnerships and in-kind partnerships. We receive local funding support from the United Way, from Johnson County, and from the cities of Iowa City, Coralville, and North Liberty. Area service clubs, local businesses, and local churches, such as yours, support the clinic's work. We're also very fortunate to have in-kind partnerships with the University of Iowa Hospitals and Clinics, with Mercy, with Steinler Orthopedic Clinic, and with the Iowa Department of Public Health. Every year, we receive over $1.5 million of in-kind patient support services, including labs, medications, radiology procedures, medical supplies, and volunteer hours. Through our many partnerships, we are able to provide over $5 worth of care for every $1 we receive. Our budgetary needs are also supported through grants, fundraising events, and private donations. The free clinic serves as a medical home for most of our patients. We provide care for them throughout the year. And over our years of operation, we've worked hard to broaden our scope of care so that we can meet their needs. At the clinic today, we have 6 medical exam rooms, 2 dental operatories, a medication dispensary, and an in-house laboratory. We hold 4 to 6 weekly medical clinics where patients receive treatment for acute and chronic health conditions. Dental clinics are held from 2 to 5 times per week, where patients receive exams and x-rays, treatment plans, fillings, extractions, and hygiene. We also hold specialty care clinics throughout the year. These include dermatology, ophthalmology, physical therapy, rheumatology, and prenatal and postpartum care. Through a partnership with Johnson County Public Health, we're able to provide our patients with HIV counseling and testing. And through partnerships with local businesses, we're able to provide our patients with vouchers to purchase eyeglasses and to help with the cost of medications and hearing aids. As I mentioned, we serve a low-income and diverse population. Last year, over 70% of our patients reported household incomes under the federal poverty level. 51% of our patients reported their ethnicity as Hispanic or Latino. 22% reported race as Black or African American. We are serving increasing numbers of immigrants from all around the world. Dr. Norris sometimes lets people know that she has seen patients from every continent except Antarctica. When the free clinic started in the 70s, we primarily provided care for people presenting with acute health conditions, for example, upper respiratory infections or in need of a job physical. And that has significantly changed over the years. Today, over 60% of our patients are presenting with at least one chronic health condition, such as diabetes, hypertension, or heart disease. Our clinic, like all medical practices, was significantly impacted by the pandemic. It required our service delivery to change, which limited the number of clinics we could hold and patients we could safely provide care for. Before the pandemic, we worked with about 200 volunteers, including providers, from a wide range of disciplines who rotated through the clinic as their schedules allowed. But at the end of March, to minimize the number of people coming into the building, we made the difficult decision of temporarily stop having volunteers provide care. This was necessary due to recommended social distancing, but again, it placed limitations on how many clinics we could hold. We also at this time made the decision to temporarily put our dental clinics on hold. Dr. Norris set protocols to protect our patients, our staff, and our volunteers. We made structural changes to the clinic's reception area to increase safety through the addition of an acrylic enclosure around the entire check-in area. All our patients were triaged over the phone, and those with COVID symptoms received information on how to proceed. In April, we increased our ability to safely serve patients by adding telehealth to our practice. Then, beginning in June, we slowly increased the number of volunteer providers coming into the clinic and were able to add additional clinics and serve more patients. We were able to resume invaluable partnerships with the Department of Internal Medicine and Family Medicine and the College of Nursing. Our dental clinics resumed in November. Today, while things are not yet back to normal, we have increased our ability to safely see more patients. But because the need to monitor the number of people in our building at one time continues, we continue to have to watch out for how many volunteers are in the clinic at once, and we are at capacity for patient appointments. As I'm sure you all can imagine, due to the pandemic, the need for our services has increased as people have lost their jobs and their insurance. Despite many challenges over the last 10 months, I am so proud that the clinic has been able to remain open, and our staff have worked so very hard to make that happen. Again, while we're confident that we now have systems in place to safely provide care, it will take some time to return to pre-pandemic level of service. And the support we receive from our many community partners, including all of you, is more important than ever. Again, my sincere thanks for your support of our work, and thank you for the opportunity to talk with you this morning.
Thank you, Barbara. Well, Barbara covered most of what I wanted to say very well, but I'm just going to add a few other things that I'd like to second her thanks to the support that we received from St. Andrew. Many of our members do volunteer at the clinic, even more donate to the clinic. We've had a member serve, at least one member serve on the board, all important areas to help the clinic continue to provide the services that are necessary. So I have been very pleased to be both a member of St. Andrew and also a member of the Free Medical Clinic staff to continue this partnership. And I'm also proud of the partnerships that we have throughout the community. Barbara mentioned a lot of the organizations that donate in-kind services to us, but I have been very impressed with Barbara also works with the organizer or the executive directors of other organizations, because as you can imagine, when patients can't afford health care, they also can't afford housing or food or other necessities. And so we do have connections with Community and Shelter House and Iowa City Compassion. And I think it's very important that we have many of these connections so that we can learn about what opportunities there are, both for people in the community who need the services, as well as people who may have skills to be able to provide those services. So it truly is a community organization. And as I said, I'm very glad that St. Andrew is such a close part of it. Barbara mentioned that we are seeing a lot of patients with complex issues, and I can specifically speak to that a little bit more. Especially in the last year, we have gotten numerous calls and referrals from hospital emergency rooms, or as patients were being discharged with diseases that I have seen rarely or rarely had to try to figure out how to provide care for. I'm very thankful that we have specialists who are willing to come in and help us. But at the same time, there are those challenges that arise day to day with coordinating patient care. And I am grateful for our staff who shows the flexibility to try to be able to do this. Our care manager, Stacy Wilkerson, has been just incredibly instrumental in being able to coordinate this care. I'm able to discuss with her whether or not we can provide services for some of these patients, because there are things that are needed. For example, we can't do any surgeries. We don't do cancer care. And so there are patients that we have to say we can't do anything to help for that problem. But it is encouraging to have somebody else around who is so knowledgeable and compassionate to be able to figure out what sorts of things we can do. The other big challenge that we have noticed, or increasing challenge, I should say, over the last several years, is the variety of patients that we are seeing, the different countries that they are coming from. Before it seemed like if we had a Spanish interpreter and an occasional French interpreter that we could call on, we could provide the vast majority of interpretive services necessary. However, now we are seeing many more patients who speak Arabic, other dialects, Mandarin, and so that has been one of our biggest challenges, to try to figure out how to communicate with those people so that they know what treatments we're recommending and why we're recommending doing that. That is something that we're still working on, and we will continue to grow and adapt and figure out what's needed to be able to provide the best care that we are able to with the resources that we have available. So I have been extremely proud of the entire staff at the Free Medical Clinic, as well as our board, who has helped us during this transition with COVID. It's not easy asking people to try to limit their exposure, not only at work, but also out in the community, in order to decrease transmission rates and keep everybody safe. Frequently, the instructions we'd give them one week would change the next week because there would be new information out there, or we would realize that something that we had tried did not work. And so it required a great deal of flexibility on the part of our staff. And so I just wanted to let you know that I have complete faith in our staff's dedication to providing healthcare, because they really went above and beyond during this pandemic in order to be able to follow our mission statement overall. So with that, I will open it up to any questions or comments. So I may have muted some people in the hopes that we could hear better, but let me know if you're having a hard time unmuting. And you can either just unmute and ask. If that's not working, I'll try to watch for people raising their hands.
Cecilia?
Yes, Paul.
I'm wondering what the role of the clinic will be in terms of vaccination for those who can't afford or have availability at other means.
Yes, we are looking into that. We have already applied. Have applied and approved to be a site. However, our big challenge is having the staff to be able to not only administer the vaccines, but also to record in the necessary database that people have received them. I believe, you know, with Moderna, the storage is not as, that's something that I think that we can work around. We have, ever since I have been here, we have struggled to do a lot with a small core group of staff. And we are trying to figure out how we can do that, since it hasn't opened up yet to the general public or those, you know, over the age of 75 or with chronic health conditions. We don't have a plan in place currently, but we are looking for that. And if anybody knows of a nurse who wants to volunteer or help out, or we're looking for an employee as well, a nursing employee, talk to Barbara or talk to me, because that, you know, that these are things that we will probably be able to use. Well, we could probably use it now, but I don't know if you wanted to expand, Barbara.
Cecilia, I just wanted to add that I received an email on Friday from one of the staff at Johnson County Public Health who reached out to me, and we're going to be meeting via Zoom next week sometime to talk about how the clinic can fit in this capacity and whether we can move forward with this. As Cecilia said, that there's some challenges, some more challenges that we're going to have to work on, but we, if possible, we certainly would like to be able to participate in getting our very vulnerable populations vaccinated. But more will be revealed as I work with my partners over at the health department, who have been absolutely incredible. By the way, I want to give a shout out to Johnson County Public Health. They have just been working so hard, and I'm really in awe of all they continue to do.
I'm afraid I've got barking dogs in the background, but that was going to be my question too, was, you know, Dr. Fauci saying 70% of the population before there's immunity. So even having the vaccination, obviously we can still be carriers. So nothing's going to change for a long time, whether you have your vaccination or not. But so Johnson County Public Health are the decision makers, but like you said, you partner with the university hospital. Of course, being there, I've seen how efficient they are at getting those vaccinations done. It's really going fast. They're getting to the staff super fast. And, you know, I know transportation issues and not wanting to go places. In fact, that was kind of my other question, was sanctuary cities or being safe places for people who are undocumented to go. But if there's a way that the populations that you serve could somehow get over to that facility where it's so fast and efficient, they've got it down. Again, I know that's kind of a general question on how the Department of Public Health is going to do the vaccinations, but just wondered how closely involved the university is.
I do not know. I have not heard of the university doing vaccinations for anybody except their own employees right now.
Yeah.
So I think, although we do have residents coming over and rotating and staff volunteering, we aren't more closely associated with the university. We aren't considered one of like their satellite clinics or something. So I do not have a lot of information on that. I will point out that at the free clinic, we are very aware of the additional stresses placed on our patients because of their race and ethnicity. And this is not just if they are here legally or illegally. There is fear out there for good reason, even depending on what you look like. Some of our patients who are here legally have been detained, and it costs money and takes time to get all those issues worked out. It's the whole immigration system is so complicated. We have tried to make our clinic a safe place. We are unfortunately very familiar with the legal requirements of what ICE needs in order to be able to enter our clinic. And for instance, unless they have a warrant from a judge, not a warrant from themselves, they are not able to go into any private areas. So we have made sure all of our areas are marked as non-private except for the waiting room. And we try to, encourage people and let them know that this, that we do not have any communication with ICE or other authorities. All our charts are paper, so that's kind of a benefit. Can't be hacked. So, that it is, that's another challenge we've had to work with.
Huge challenge. And congratulations on 50 years. That's so exciting.
Cecilia, for the translation piece, does it work to use the telephone translation services?
Barbara, do you want to talk to that? We looked into that, but I believe it was prohibitively expensive.
Yes, I continue to look into the options that are available out there. And yeah, it's at the top of my list. As the new year begins, we need to find something that's affordable and very user-friendly, because I know it's, as Cecilia mentioned, it just adds another layer of another barrier if we can't communicate in the languages that our patients speak. So I continue to work on that. If any of you know anything, please feel free to let me know. The ones that I've looked at are quite costly, and I'm going to be writing a grant to help cover these costs in the coming months. And I hope that by the end of this fiscal year, we will have something in place.
Yeah, that would be good. That would be very helpful for you. I don't know what system Community uses, but that's the only one I'm familiar with. And I don't know what it costs. I just know that it's available for interviews. And
Yeah.
it can.
And again, one of the challenges that we will work around and keep in place is there are many different steps that a patient goes through at the clinic when they come in, because obviously they check in, they get their vitals taken, and then they meet with the provider. But we also have a dispensary where we hand out medications, and so they will receive medication instruction there. If they get laboratory work done, they have another interaction with the person there. If they are getting diabetic education, diet, exercise type things, they would meet with somebody else, or the HIV counseling. And so we have the potential for, a patient to need translating services for half an hour or 45 minutes. And at $1 to $3 a minute, that adds up. So, but Barbara's great. Barbara's great at finding grant opportunity and working around things. I mean, we have partnerships with the nurse practitioner training program and the prenatal program, diabetic education, the American Thoracic Foundation, American Medical Association, although that one is that over, I can't remember. But I mean, she's aware of the great needs that we have and has been able to work with those. So.
I wanted to share with all of you, if you would indulge me. A lot of times I think it's helpful to hear a story, something that happened at the clinic, to really get a sense of some of the challenges that our patients face. And I'll never forget one particular instance. Two summers ago, it was a very hot Friday afternoon, and we generally close Friday afternoon. So I was at the clinic finishing up some work. This was pre-pandemic. And I heard someone knocking at our front door. and went out to see who it was. And it was a Sudanese woman who was 8 months pregnant and could not speak English, and had walked from her home in the Broadway neighborhood to the clinic. And again, it was a very hot day. She obviously was overheated and was very frustrated, and I couldn't understand how I could help her, because she couldn't speak English. So I asked her into the clinic to help her cool down, and tried as best I could to find out what she needed. I mean, it was obvious she was pregnant, but she was in distress. And so what I did was I called one of our many, many community partners that Cecilia mentioned, Iowa City Compassion, who were fortunate to have as neighbors. They are situated right kitty corner to us. And someone there spoke Arabic or Sudanese. I'm sorry, I don't remember what the language was exactly, but they were able to help interpret. And it turns out this woman was diabetic and had run out of her insulin, and was relatively new to Iowa City and just didn't know where to go. And she'd heard about the free clinic, and again, walked over to the clinic. I was able to call Cecilia that day, and we were able to piece together some medication for her based on what we could learn through with the interpreter's help. And we're so fortunate to have had that interpreter, because there was no way we could have helped her without knowing exactly what medication she was on, how much she was taking, that kind of thing. So we were able to provide her with some insulin. I was able to, again, with the interpreter's help, set her up for an appointment to get some more assistance, and I was able to give her a ride home. That whole interaction took about 2 hours. And at the end of it, I was so grateful on so many levels for everything that had happened, but also so saddened by how difficult it had been for her to get her needs met. It spoke very highly of our community, but it spoke very poorly of our healthcare system in this country. And I can't emphasize enough how proud I am to work at the free clinic, and with Cecilia and with the rest of the staff, and within this incredible community that has supported us for 50 years. I know I'm preaching to the choir when I say our healthcare system it just is so terrible and so unfair. And we at the clinic and all our partners recognize that and work daily to break down those barriers so that people can get the care that we all need to live and to thrive in our community. Again, I think it's just helpful to hear stories like that, to really get a picture of what's out there and to recognize the importance of the clinic's mission.
Can you address mental health services?
I'll let Cecilia speak to that more. It's a tremendous need in our community. We at the clinic, we do not offer it officially. We do not, because we aren't set up to do that. But, well, I will let Cecilia talk about how we help people do that.
Yes, we do not offer counseling services at the clinic. Iowa City Compassion recently has been offering counseling services to immigrants and refugees. So that can provide an outlet for many of our patients. Most of the doctors there will prescribe some of the basic anti-anxiety, anti-depression medicines. There is a free mental health clinic, but I believe it operates one morning. I don't know if it's a week or a month. It's Saturday mornings. It's staffed by students and supervised by attendees at the Department of Psychiatry. So as you can imagine, that service is also hard to get into and to use. So we kind of do what we can, and as I said before, we work with the resources available and try to provide some relief, at least, for patients struggling with mental illness. But we are clear that we can't provide really the ongoing counseling that is so beneficial. We have a hard time seeing the patients more than once every 2 to 3 months because of the high demand for our services. And that's not ideal for mental health care.
I will add that the providers we have at the clinic are so compassionate and caring that I know that is one step in helping people who are in need of counseling, just to know that someone is listening to you. And I'm grateful that we're able to do that.
All right. Any last questions? Oh, Paul.
You have some connections with the consultation for religious communities in terms of resources or suggestions of how those relationships could be forged?
I will. I know we've had some interaction with the group before, but thank you for that reminder. I will reach out to them again. Thank you.
Certainly.
I have a silly question. What are your plans, if any, for your 50th celebration?
Well, our official 50th year begins in February. So starting in February, we have some plans, we have some hopes, depending on how things go in our country, obviously. But we plan to make a historical video when we're asking people who have worked with the clinic, who have volunteered at the clinic, and even people who have used our services over the past decades to share their stories with us. We thought it would be wonderful to put together firsthand experience of people who have been involved with the clinic. We're also planning to do some interviews that we'll put on our Facebook and website with people who are involved in the clinic in various ways. We are also going to try to raise $50,000 throughout the year in honor of the 50 years through various means, and those will be announced on as we proceed with that. But we'd like to try to raise $50,000 at $1,000 in honor of $1,000 in honor of every year of the clinic services. In the fall, if we're able to, we'd like to hold an open house. It may be in our parking lot, and the weather would have to cooperate for that, obviously. But we'd like to have an open house and have people hopefully be able to come into our clinic, see firsthand our facility, meet our staff and our board and our volunteers. Again, it may be in the parking lot. We may have music. We'd like to have music and food and just a time to really celebrate with our many, many supporters this really monumental achievement of 50 years. And more will be posted as our planning continues.
We'll be watching.
All right, well, I am going to close this in prayer, and then I'm going to attempt to screen share. Jeff Priest Carlson just finished the video that he put together from a talk I gave, I think 2 years ago, and pictures of the clinic. So you all are invited to the grand premiere of the free medical and dental clinic video that will be posted on the St. Andrews site at some point. So if you're interested, you can stay around. Hopefully I will be able to screen share that as well. But thank you again, everyone, for coming, for your support, for your interest, for your prayers. So, Heavenly Father, we thank you for this time together. We thank you for the community that we live in. We thank you for each individual who is part of that community and contributes in the ways that they are able to make us stronger, a stronger, united body with all the diverse parts that you have so graciously created in your image. Thank you in the name of your Son, Jesus Christ. Amen. So here we go.
Yes, I'm very honored to serve and work at the Iowa City Free Medical and Dental Clinic. This organization was founded in 1971 to provide medical care for acute problems for the uninsured in the community. And over the past 49 years, it has grown to provide more comprehensive medical care for both the uninsured and underinsured people of the area. The Free Medical Clinic is run primarily by donations from community organizations, local government, private donations, and volunteers. With your help, we were able to serve over 2,600 patients at 6,500 visits last fiscal year. Patients come to us for management of acute and chronic medical conditions, assistance accessing medications, and for dental care. We have many connections with others in the community. We partner with the hospitals to provide limited radiology and laboratory testing. Education of future healthcare professionals is also integral to the clinic. Medical and physician's assistant students volunteer in the evenings. Our nurse practitioner cooperative program with the UI College of Nursing is starting its third year to provide training and awareness for nurse practitioners working with the underserved. And residents and fellows in several specialties, including family medicine, internal medicine, dermatology, ophthalmology, and rheumatology, help us to provide even more comprehensive care. With your help, the Dick Parrott Free Dental Clinic saw 527 patients last year, providing dental hygiene, x-rays, fillings, and simple extractions. We also work with the Healthy Kids clinics through the school to provide dental care to children. Many St. Andrew members volunteer at this clinic, and others support it financially. And the Free Medical Clinic is truly grateful for all of the support that you provide. We truly could not do this without all of the help that we get from this congregation and from the community at large. If you're interested in learning more or would like to volunteer or contribute, you can visit the website at freemedicalclinic.org. I'd just like to end with a quote from one of our patients. I was nervous because I haven't been able to buy my medications for a while and didn't know what was going to happen. I want everyone to know that I was treated so well. The doctor was so nice, and I had labs and got medication, and even learned I could get a dental appointment. You listened to me and helped me. You are just great, all of you. Thank you so much. And I'm so thankful that one of the things that we are recognized for is listening to people, because I think that that is just so important. So I'd like to thank you all for listening this morning.